A blood pressure cuff is used to diagnose high blood pressure. An aneurysm can be identified on a CAT scan or an angiogram. Even diagnosis of COVID is straightforward with a nasal swab. But because an eating disorder is a clinical diagnosis, no definitive diagnostic tests are available. This is especially true for anorexia. You can't pull up to the urgent care and draw anorexia labs or swab your nose for anorexia. Instead, it requires a much more complex and nuanced evaluation. I'm Dr. B, and in this video I will teach you how to recognize anorexia, especially if you're not a medical professional, including the two different patterns of anorexia and how the American Psychiatric Association defines anorexia, and please stay to the end to learn the most common, the most devastating and surprising reason anorexia can be fatal. To be diagnosed with anorexia nervosa, the following 3 criteria must be met as defined by the American Psychiatric Association. Number 1, an individual has to have a consistently low calorie intake leading to a markedly low body weight. This can occur in 2 different ways, depending on the 2 subtypes of anorexia. The first subtype is known as restricting type of anorexia. This is where there is a severe limitation of food intake as the primary means for weight loss. This can be from closely watching caloric content, counting calories, and avoiding caloric-rich foods, or more often, just eating a very small volume of food overall. Now, this is in direct contrast to the binge eating, purging type of anorexia. This is where there are periods of adequate or even excessive food and caloric intake. This is then compensated for by self-induced vomiting, laxative or diuretic abuse, and commonly excessive, compulsive, and all-consuming exercise. So the number of calories is just not adequate for the level of activity. Now, the diagnosis of anorexia must consider each individual, and caution is advised in using strict numbers. In the past, weighing less than 85% of ideal body weight or a very low body mass index, or BMI, less than 17.5 were used as criteria. That has been determined to be too simplistic because you must take into account the person's age, whether they're male or female, and overall physical health and especially developmental stage, and you must look at genetics. Some teenagers can be very thin and entirely normal given their growth stage and parents. In addition, there are a number of diseases that can prevent people from absorbing food from their intestines, such as cystic fibrosis or Crohn's. And although often these are obvious, some of these bowel diseases can be undiagnosed, and they shouldn't be confused with anorexia. Number 2, an anorexic individual has an intense fear of gaining weight or becoming fat, even though they are physically underweight by all appropriate medical and social standards. A typical case of anorexia involves a young person, that is a teenager or young adult, who is mildly overweight or even of normal weight, who then begins a diet and exercise plan to lose weight. As he or she loses weight, they receive initially very positive reinforcement for this behavior, compliments by peers, parents, or others. The reward is high, and this can eventually lead to an inability to stop this behavior, even once an ideal weight is achieved. There is also significant evidence that there becomes or is a pre-existing imbalance in brain circuits governing reward, emotion, and consequences. In addition, eating can cause significant anxiety, whereas calorie restriction can relieve this anxiety. Number 3, those with anorexia experience a profound disturbance in the way that their body weight and shape is self-experienced. Self-esteem and self-image is significantly altered by someone who has anorexia. They have a very inaccurate perception of their own weight and their appearance. It is like they see the world through a markedly different and unique lens. The outward expression may also be in conflict and varies with sufferers, some wearing too tight of clothes to demonstrate their weight loss, and some wearing very baggy clothes to prevent others from seeing their true weight. In the face of overwhelming evidence, those with anorexia deny the seriousness of their low body weight, despite concerns of family, friends, healthcare providers, and there is a progressive health decline. The common findings seen are low blood pressure, irregular or slow heart rate, yellow, jaundice-appearing colored skin, depression, hair loss, loss or lack of sexual drive, loss of menstrual cycles, and cognitive slowing. None of these findings are well recognized or are completely denied by the person suffering from anorexia. The self-starvation leads to protein deficiency, disruption of multiple organ systems including the heart, kidneys, bowel, skin, blood, and brain, with loss of cognitive function. However, the most tragic result can be cardiovascular or heart complications. Cardiac complications are the most common cause of death, and the mortality rate is as high as 10%. When the anorexic individual undergoes starvation, there can actually be a decrease in the size of the muscle making up the heart as the body consumes it. However, the truly devastating result is that cardiac decompensation and risk of death is greatest when someone recognizes their illness, begins recovery, and begins refeeding. The initial 2 weeks of refeeding is the most risky for death. The heart muscle just can't stand the stress of the new metabolic demand as the patient becomes more active and the body begins to reverse its shutdown. The good news is that if the refeeding is done at a slow rate with controlled weight gain, it can markedly increase the safety and the cardiac death can be reduced. If you think you or a loved one is suffering from anorexia, please seek help from a qualified medical professional. Thanks for watching. And for more educational videos, try clicking on this one on narcissistic personality disorder, or check out this playlist of shorts on personality disorders. And please don't forget to hit subscribe below.